Hello, and welcome to HeartSense's Fireside Chat series. Today, we will be discussing health inequities within the LGBTQ community with one of our co-founders, Dr. Antoine Keller, and our special guest for today, Jason Bellet, co-founder and chief strategy officer at ECHO. Dr. Keller and Jason, welcome, and thank you so much for joining me today.
Thank you.
Hello, Sabrina. Thank you so much for hosting the talk today. I'm very interested to hear what Jason has to say about this issue.
Yes, so am I. And Jason, thank you so much for taking time out of your day to join us to talk about such an important topic.
Absolutely. Anytime. We love our partnership with HeartSense, and thanks so much for thinking about us.
Yes, of course. So speaking of the partnership with HeartSense, we would love to know, tell us the community, how did ECHO decide to partner with HeartSense, and in what capacity does ECHO support this organization?
We are really honored to help partner with Dr. Keller and HeartSense. I'd have to go a little bit back in time, but it was just before COVID, we first connected with Dr. Keller and learned about his work reaching out to underserved patient populations in Louisiana. As a cardiac screening company, we're really focused on building technologies to help healthcare providers on the front lines of care more accurately detect underdiagnosed or undiagnosed conditions with our smart stethoscopes. But if we aren't intentional about making sure that our products reach healthcare providers that are going out into the community and reaching patients who are disproportionately impacted by the social equity gap and thus the healthcare gap, then we aren't doing our jobs as an organization. And so it's been an honor to work with Dr. Keller to both donate our products and also donate our software to facilitate in-person screenings and pop-up clinics in multiple locations throughout Louisiana, and also just take a step back and really talk to him about the healthcare disparities that are impacting our country and the role that we as a cardiac screening company and as a healthcare community have in helping to address that. So thanks, Dr. Keller.
Yes, Jason, thank you so much for the opportunity to be able to partner with you guys. One of the things that we noticed really early on when we started doing transcatheter heart valve replacement is that there are so many people who come to the doctor and either get misdiagnosed or don't get diagnosed at all with valvular heart disease. And one of the things that is most impressive about our analysis of the reasons why people don't go to the doctor or don't get treated in the way in which we think the guidelines recommend that they get treated is because we don't know about them. So there are so many people in disadvantaged communities, and I say disadvantaged communities because I want to include other communities, not just racial and ethnic minorities. We have disadvantaged communities that are poverty stricken. We have communities in which people might not think they were disadvantaged, like the LGBTQ plus community, which many people, when you talk about racial and ethnic minorities, you don't include them in that group, but they are certainly a disadvantaged population. I'm sure you'll get into that in a little while, but it is really important for us to be able to go out into the community to reach these people. And this technology gives us such a wonderful mechanism to be able to go out and actually touch people and give them some useful information to have the confidence to go and take a day off work to go to the doctor, or to skip the pay that they would get from that day that they had to go to the doctor, and go and take care of themselves so that they can be around for their family in the future. And it has made a tremendous difference in our community. And we hope to be able to make that difference in communities all over the country with the same technology, because of the fact that it's portable and it's such smart technology that we feel it has really changed the paradigm for discovering people who have valvular heart disease. So thank you very much for trusting us enough to be able to partner with us on our projects that we have in the community.
It's an honor.
Wonderful to hear this partnership that's been longstanding in such a short amount of time that HeartSense has been established, and it's so important to the community and to have this access to this type of healthcare. for, years to come, generations to come. So why don't we get started with the questions for this particular topic? There is a lot going on right now in the country, and according to the American Heart Association, there is more than half, 56% of LGBTQ plus adults that report experiencing some form of discrimination from a healthcare professional. That's more than half. And there's approximately 4.5% of adults in the United States that identify with the LGBTQ plus community. So having said that, and with everything going on, how does social policy affect the health outcomes and overall well-being of the LGBTQ plus community? And I'll start with Jason.
First off, 56%, more than half. That is just mind-blowing statistic.
Yes.
That 1 in 2 LGBTQ patients in this country have experienced discrimination from a healthcare provider. And I think that exists at the policy level, it exists at organization and healthcare system level, and it exists at the individual level. And so we can talk about it at so many different parts, but your question was really around policy. And there's been some pretty significant strides in social equity and rights for the LGBTQ plus community in the last decade. We saw the repeal of DOMA and Proposition 8 here in California. We saw the Supreme Court add LGBTQ plus and sexual orientation and gender identity as protected classes, so that people, healthcare professionals, can't be fired for being openly gay, which in about half the country they could have been fired without repercussions up until 2021.
Oh, wow.
It was mind-blowing. So you literally could have come out in half the states in this country and have been let go because of it without any repercussions. It was not a protected minority class. And then, even going back to, our military and being able to come out and say that our armed services, they don't have to, they can come out and tell. It's not, the don't ask, don't tell was repealed. It's hard to, the list goes on and on, but we've come so far in the last 10 years. But social policy and health equity are completely linked. And we see that in a couple of instances within healthcare, certainly in the responsiveness to pandemics and epidemics. When you look at the AIDS crisis in the 80s and the 90s, the healthcare community responded far too slowly and took way too long to recognize an epidemic that was tearing through the LGBTQ plus community because policymakers weren't responsive to the LGBTQ plus community. It didn't hit them in their voting base. It didn't hit them in their communities. And therefore, they didn't fund the research and they didn't fund the response at a federal level that we saw manifest so quickly and so powerfully with COVID. It hits, at the individual level with patient visitation rights and the rights to start and build a family. In so many states, same-sex couple who may have been unmarried or unable to marry, but have built their lives together, were unable to visit each other on their deathbeds in the hospital, were unable to make critical life and death decisions because they weren't next of kin. For same-sex couples who wanted to adopt children, they weren't able to share custody of the child. It's just the ability to live authentically and to love authentically is so intertwined with our health and well-being. The last thing is just, we talk about mental health and making mental health accessible to Americans, and it isn't accessible today. And that starts at the policy level. It starts at, the Affordable Care Act and making sure that patients have insurance and access to a therapist and the ability to seek counseling. And we've come a long way, but when you look at the disproportionate mental health impacts that the LGBTQ plus community experiences, where I think it's about 40% of LGBTQ youth contemplated suicide. Suicide ideation in the last year. If they can't get access to mental health services in their communities, that's a mental health, public health challenge. So anyway, they're so intertwined. It's hard to narrow it in 30 seconds or a minute, but it's a great question.
So,
Wow.
Sabrina, if I might ask Jason a question. So, the question she started focused on whether someone has experienced discrimination in medical care or not. And I would like to riff on that just a little bit and try to see if you can describe the importance of cultural sensitivity in interactions that people in the LGBTQ community have with their physicians. We have
Yes.
some similar issues focused around what we do with minority patients, but having more physicians who are LGBTQ members or people who are in medical school or physical therapists or occupational therapists is really important, because there are things that are common to LGBTQ people that people who are not living every day in that community would not know about. And so can you talk to the cultural sensitivity that having practitioners that actually identify as LGBTQ and the difference that makes in their treatment whenever they go to the doctor?
Mm-hmm.
Yeah, it's a great question. And I think we can hit it from two sides. One is so powerful when healthcare professionals do come out, because, and we're starting to see LGBTQ plus almost as like a healthcare issues, almost as, I don't want to say a specialty or a focus area, but you're beginning to see it listed on healthcare system websites as an area of focus for given providers. You can actually go to Psychology Today, which is one of the major repositories of therapists and psychiatrists in the countries, and filter by LGBTQ plus therapists, because that relationship to the community does have such a significant impact in their ability to understand the LGBTQ plus experience. And patients feel much more comfortable in many cases going to a healthcare professional that understands that journey. And so to your question, I think creating opportunities within a health system for a healthcare professional to come out and do so safely, and then even taking it a step further and actually building a program around it so that LGBTQ plus patients can find those healthcare professionals and come in and talk to them. Because I think it's really, and this is probably for any minority community, you don't want to spend the 15 minutes of your physical exam teaching the healthcare professional about the unique issues impacting your community. You got 15 minutes.
Right.
The more that you start with a shared understanding and know that they're asking you the right questions and guiding you towards the right level of care. There's a specific set of healthcare questions that a man who has sex with other men should be asked, that a healthcare professional needs to know to ask, and certain preventative medications that patients can get on to avoid contracting HIV and to avoid contracting some of the life-threatening conditions that have disproportionately impacted the LGBTQ plus communities. I think beyond that too, you don't have to be LGBTQ plus to be trained and educated in the healthcare issues impacting the community. So I think, I don't know if in your medical school, Dr. Keller, that was part of your medical training or, your specialty training as a cardiologist, but I think there is an opportunity to, and I doubt it was, because it's just sort of become embedded in the medical training curriculum in the last decade. I think there's an opportunity to retrain. And I think if we could develop programs to help train a broad spectrum of our providers on what are the distinct issues impacting the community, what are conditions and mental health challenges to look out for, and how can, to your point around inclusivity, how do you approach an LGBTQ plus patient in a way that makes them feel included? How do you ask for their gender pronouns? How does that even come up in a patient conversation? And so I think it's a great question. And to be honest, I think we're still sort of figuring it out.
Yeah. And I think, not that people who are not in the LGBT community wouldn't be a good doctor. Like, as you alluded to earlier, we have good doctors all over the place. But there is an element of implicit bias that goes into treating people who have experiences that are different from yours. And the sensitivity about implicit bias is something that is really important, and I think really needs to be stressed for practitioners more than anybody else because of the reasons that you described in your answer. There are things that are specific to certain patient populations that physicians who are going to be treating those patients would be versed to be able to know about, so that they can appropriately treat those patients and ask the right questions.
Mm-hmm. I mean, you both just had such a wonderful conversation that covered the next two questions that we were going to discuss. So I commend both of you. Thank you so much.
Yeah, we're looking out for you.
Did want to note that in 2018, that was when the American Medical Association added sexual orientation and gender identity as an option for those members to include this type of information. So that, really wasn't that long ago. So as long as we keep progressing in this route, that is going to just really help with the comfort level of the healthcare professionals and the patient, because so many patients are withholding their health history because they have some kind of fear or trust concern with a healthcare professional, even if it's someone new in their life that's this healthcare professional. They've already had this experience or know of somebody. And so to hear both of you talk about such an important conversation and understanding how it needs to start even just through, medical school to really continue all of this is just so wonderful. So, yeah.
There's sort of been a huge uptick in medical schools, obviously building resource groups and student groups for LGBT plus patients. And I think social media has really become sort of a virtual town square for this next generation of healthcare providers to find each other and build that community. And so you've seen LGBTQ plus in medicine, which is a hashtag that's gone pretty viral on Twitter, or I think it's gay med Twitter is another one. And these are gathering places for LGBTQ plus med students and nursing students and all the way up to practicing providers to come together and educate each other, which has been amazing.
So we've already kind of talked about how healthcare professionals need to be more aware, the kinds of questions they should ask, but can you kind of give just a rundown or an overview of how they can be more mindful and aware when treating patients, even if they don't know that they're of the LGBTQ plus community, like not making assumptions?
Yeah.
So Jason.
Absolutely. I think it starts with letting every patient know that comes through the door that this practice and this provider welcomes the LGBTQ plus population. And it seems like a little thing, but putting a pride flag on the wall, wearing a pin with the rainbow pride flag, having in your email signature or on your website your preferred gender pronouns, signals to the community that you're foundationally ready to even have the conversation. It's a welcome to my clinic, just sort of experience for them. And at that point, then, there's opportunities to kind of dive into discussion, because you're basically saying this is a safe place. I think it's really important that providers ask patients what their preferred gender pronouns are and document that. A big challenge today is that there's not, in many EHRs, a dedicated field for preferred gender pronouns. And we know healthcare providers see hundreds, if not thousands, of unique patients a year, and sometimes it's hard to remember. So creating a note or a place in the EHR that by the time the next patient comes in, or by the time that patient comes back, you don't misgender them, and you remember that as you would remember their first name and their last name, right?
Yes.
And beyond that, I think it's. Yeah, I guess I'll pause there. I think those are some of the kind of simple opportunities for healthcare professionals to welcome LGBTQ plus patients into their clinic. And then from there, you can sort of build a trusting relationship with the patient like you would with any patient. It's right. It's not rocket science. It's really about just meeting the patient where they are and recognizing them for who they are.
So I have had the fortune to treat several transgender patients following gender reassignment surgery. And I have had the opportunity to learn a lot about an interaction with transgender people from a healthcare provider to the patient standpoint, can you give some practical information about how healthcare providers should interact with people who are transgender, for instance? What kinds of things do you need to know as a clinician, and what kinds of things do you need to ask people who are transgender to be able to understand the breadth of their concerns with regard to healthcare?
Mm.
I'm sure there's a working group of practitioners who have really thought through this. From my perspective, I think certainly creating an opportunity to ask the patient for, if sex at birth is relevant from a medical perspective, differentiate that from gender identity, and then ensure that you make it clear to the patient that you welcome transgender patients and LGBTQ plus patients into your practice, and that this is a safe space for them, and celebrate, their transition. But I would imagine that there's some really great training out there, and I'd love to find it and get a link to it and share that out to anyone watching this.
Yeah. Okay, so I want to kind of bring this back to HeartSense after hearing that Dr. Keller has had these amazing experiences treating so many different people, so many walks of life. How can HeartSense, the organization, aim to address the inequities not only in the minorities of the Black and Hispanic communities, but within the LGBTQ plus community?
Great.
Yeah, we would welcome the opportunity to be able to go out and screen people at community events related to the LGBTQ plus community. We want to take care of disadvantaged populations in general, and the more publicity we can give to these organizations to be able to help their community, the better off everybody's going to be. So we want to make sure that they feel comfortable asking us to be able to help them, just like the Methodist Church asks us to be able to help them and their constituents. So we have an open door policy with regard to anybody who wants to contribute to the health and well-being of their communities by asking us to come and bring our fantastic technology out into the community to actually touch people.
That's amazing, Dr. Keller. And additive to the work that you're already doing, you're already, by going out into the Hispanic and the Black community, you're already treating LGBTQ plus patients, whether or not they're out or not. And so I think I'd love and believe that HeartSense has this opportunity to really kind of spearhead and be an example of what it means to be an inclusive practice, both internally and externally. So I think there's an opportunity, what you're doing right now, celebrating Pride Month with this discussion, putting on that rainbow pin when you're out in the community will make a big difference for patients who may not feel comfortable openly disclosing that, kind of without that invitation, and adding your gender pronouns to the email signatures and professional bios that are on the HeartSense website. Those are just very little tiny signals. And yeah, go ahead.
Yeah, so I didn't realize that adding my gender pronouns to my email would be an indication that I might be open to treating patients in the LGBTQ community, but I think I'm going to do that right now because I think it's a great point, and I don't think that a lot of people know about that if they're not in the community. So thank you for educating us.
Absolutely. And listen, I know, Dr. Keller, you're involved at the state level in Louisiana. And so back to Sabrina's first question, it starts with policy and making sure that certainly in this environment that the rights that LGBTQ plus patients in the community have fought for in the last many years do not get rolled back, both within the healthcare environment and outside the healthcare environment. So I think there's an opportunity to at least be an outspoken advocate at the policy level too. And I know HeartSense is such a respected nonprofit, and that you're such a respected provider in the community. You have a unique platform to do that.
Well, this has just been such an amazing experience to be able to be educated for the community that's on our social channels, on our website, and for us, and for even Dr. Keller in this moment to discover that he didn't even know having his pronouns on his email signature or mentioning that in some way was such an important element as a healthcare professional. So that is so meaningful to see something like that happen live, that discovery. So thank you, Jason, for educating us today. And I just have one more question for you. So I'll just start out with that. This year, we're celebrating the 52nd anniversary of the first Pride Parade that happened. And I would just like to know, for you, who's someone that's so confident in being your authentic self and really just putting it out there to the world to be your authentic self, especially in healthcare. And as an openly gay, founder of a healthcare technology company with Echo, what does pride signify for you?
Thanks for that question.
Yes.
Yeah, 52 years. I've been doing a lot of reflection because this is the 10-year anniversary of when I came out to my family and to my friends. So it's been a decade. So I wanted to take a minute and sort of reflect back on it. And as I reflect back, my journey coming out was so profoundly different from what you often read about and what so many LGBTQ youth experience. I was surrounded by love and support. I had a community around me with highly visible. I lived in the San Francisco Bay Area, so pride was a huge deal. There were queer politicians and professors and doctors. And so I look back with tremendous gratitude on my coming out. And it was because of the visibility of people around me and the celebratory nature of it that I felt comfortable living authentically. And I think the spirit of pride is to try to take that and revisit it every year and broadcast it out to the world so that people who don't live in as inclusive of communities and who don't have receptive families and friends and loved ones around them who support them see when they're watching Channel 4 that there's a pride parade happening in their downtown or in their town, and that there's people out there who want them and who welcome them and who see them. And that visibility is why we're loud and why we're proud and why we parade down the street waving a rainbow flag. It's for each other, but it's for the person watching at home who doesn't have that around them. And I think, for me, it's also about celebrating the civil rights advocates who fought for me to be able to have the experience that I have, many of whom are still alive today and are around to see so much of what they built manifest. And so to have them visit the Pride Parade and be able to celebrate them every year and their tireless work, starting, at Stonewall and certainly much before that, over the last century, is worth celebrating. So that's a big part of it as well.
Wow, that was, oh my goodness, that was so moving. Thank you so much, Jason, for your time today. And again, thank you for educating us in the community, and happy Pride to everyone. And Dr. Keller, would you like to say anything to close out?
I just want to say that I appreciate the work that y'all are doing at Echo. I appreciate the fact that it is a comfortable environment for you so that you can continue to do this amazing work that we have collaborated upon. And if we can help you in any way, please don't hesitate to reach out. And I really, really appreciate you taking the time to come and help us and help our community and spread the word about the kinds of things that are really important in the lives of the LGBTQ population. So thank you again.
Thanks so much, Sabrina and Dr. Keller. And we're proud partners and excited to just be getting started with our partnership. So look forward to talking to you soon.